Hey guys, David here, and I wanted to give you a little quick tutorial around the shoulder joint. Um, the shoulder joint is the most unstable joint in the body, and you'll see why here in a moment. So, of course, this is the shoulder itself. This is the acromion, and of course, we have the subacromial space here. And this space here, of course, this is where a lot of the problems that we run into when it comes to actually shoulder impingement and, of course, a lot of pain in our shoulder. So if you look at this space here, it's really only about 10 millimeters of space is in that gap. And I think it's generally a little bit less for women. So 10 millimeters is not a lot of space. And in this space, of course, there's a tendon called the Supraspinatus Tendon. That's a part of the rotator cuff, which I'm sure you're familiar with that word. And so the rotator cuff tendon is actually, it's one tendon that actually pulls together all the muscles of the rotator cuff complex. And of course, there's several pieces of tissue here that all combine together to share one tendon that run underneath this space. And of course, now that tendon will attach down here. Now, part of the challenge that we have for most of us, of course, is the issue of posture, inflexibility, and weakness. Right? So the issue with posture, of course, what we're referring to is that this space here in the front of the body, of course, the pectoralis or our chest would actually take up this space here. We have the anterior part of our shoulder, right? So the anterior deltoid. And then, of course, we have our neck musculature running up here. So because we do so much work in this forward flex position where the head moves off the cervical spine, so the head is drifting forward with a bit of a tilt in the actual spine itself, is that the muscles of the neck are becoming exaggeratedly tight. So we're too tight in the neck. We're too tight in the front of the shoulder just because we allowed ourselves to adopt this rounded posture. And quite often we're too tight in the pectoralis area. So too tight in the shoulder, too tight in the pec, too tight in the neck, which pulls the body down and forward. And then, of course, if you have tightness, then, of course, you got weakness. And the weakness will be in the rotator cuff, of course, the musculature that fits into here, and it comes under the acronym of SITS, S-I-T-S, right? So the SITS acronym is just an acronym for the four muscles of the rotator cuff complex. And then you have, of course, a few other pieces here. Now, you notice that the shoulder blade actually sits actually away from the rib cage. Well, there's a series of muscles called the subscapularis. So sub means underneath, and scapularis, of course, referring to the shoulder blade, the scapula. So the subscapularis will attach from the back of the shoulder blade and attach to the rib cage itself. And it helps pull the shoulder blade into the rib cage to offer some extra stability. Those of you that actually have winging shoulder blades, where the bottom part here, so the lower portion of the shoulder blade actually wings away from the body, of course, you'll see that is indicative of the shoulder instability. You'll see that quite often in young children as well, as they're starting to develop. So part of the challenge is that we need to develop greater strength in the rotator cuff. We need to develop greater strength in the rhomboids and the mid and lower trapezius muscles that'll take up this region here. So if we have greater strength in the back, of course, correspondingly, we need, of course, greater flexibility, greater movement to the front of the shoulders with the anterior delt, the pectoralis, and the neck musculature. So again, it's really quite a challenge when you're dealing with shoulder issues, as some of you already know, because you've already been down that road. So just think about it. So when you're dealing with impingement or shoulder-based issues, what you would try to avoid is, of course, any sort of pressing activities on a horizontal plane this way here, which would be like push-ups and bench press and that sort of thing. I really want to minimize that. Either not do them at all or very shallow, short range. But in order to be able to do that properly with a bit of a shoulder impingement, you want to make sure that this is fully retracted and anchored in place. So this ball is actually brought back into position. So if you're migrated too far forward, drawing your shoulder blades back and down, you should take the humerus, take the head of the shoulder, and draw it back into neutral. So we want to be able to, of course, avoid a lot of pressing activities, so push-ups and bench press, activities like that are actually quite deep, which put a lot of pressure on the shoulder, and anything vertical. Anything overhead, of course, will be a challenge because, again, if that space is compromised, you're not going to be able to do that without actually running the risk of actually irritating that poor tendon. If we come up closer here, and you'll see that again, if the tendon runs underneath here, so your supraspinatus tendon runs under this position, and this ball is constantly being driven up and hammering into this acromion, it's trapping the tendon, and it actually just keeps feathering it, which keeps, basically you just keep wearing it and taking chunks out of it until such a time you get a partial tear or a full tear, and then of course life as you know it's going to be very, very frustrating and uncomfortable. And there's lots of people out there with partially torn or torn rotator cuff tendons, and it's really quite of a nightmare of a process. So we want to really look at reducing the inflammation. So if you're using medication, make sure you use it consistently. You want to ice pack the shoulder quite consistently. You want to avoid things that irritate it. So even things like using the elliptical, going for a run, even cycling. If you're outside on a bike and you're leaning forward, of course, you can put adverse stress on that shoulder joint. We're really trying to offload it as much as possible, reduce the inflammation, strengthen the posterior chain, and anchor the shoulder back into place. So it's a bit of a timely process. It does take a bit of time to really gain control over it. But again, remember the reason why the shoulder is an issue to begin with, because it took a long time to get here. Most shoulder injuries, unless it's trauma, it's generally the side effect of what they call insidious onset, which means it took a long time to get here, and now we're contending with a series of bad habits over time, and now we got what we got. So remember my conversation around posture. Posture is king. That's why we use, of course, we use the whole acronym of SAM, and really dealing with stability first, shoulders back and down, knees soft, again trying to take all the stress away from the upper body and take it down to the lower segment. We really want to focus on, of course, using yoga effectively. Some of the yoga movements, like let's say a downward dog, may be a little more challenging, so some postures you may want to avoid. But again, we want to use dynamic flexibility like yoga, which is why I'm such a huge proponent of it being part of a program. And really being mindful of the exercises, if you've been given any, to actually really work on, of course, on increasing the flexibility of the areas that are tight and increasing the stability of the areas that are weak. So the body is really amazing. It's really such an amazing piece of work, and really you have to get smarter if you want to run this thing properly. So again, if you're working with a physio or chiropractor and they give you things to do, make sure you do them. And if you're unsure about the activities, the exercise you're doing, ask for clarification. Right? So it's really important to have your shoulders function, because again, well, imagine if you sprain a thumb, how much of a nuisance that is. Well, not actually having a shoulder that's functional really interferes with your life. Yes, you want to deal with the anterior part of your shoulder. You want to deal with your pectoralis, and of course you want to deal with the neck musculature as well, right? So lots of little things to work on, but again, very complex joint. We live in a very amazing work of art, and the more you get to understand it, I think the more you appreciate it. All right, guys, hopefully this was helpful, and we'll check in with you soon.